This conference will now be recorded.
Okay. So good afternoon, everybody, and thank you for joining us at this webinar this wonderful day. I know that we are all at different time zones. Some people it's night where you are, some people it's morning where you are, but thank you for taking out the time out of your busy schedules to attend this webinar. And I want to especially welcome our mentors who have also for being here. So thank you so much. And then we have with us somebody I respect so much, somebody who I consider as my mentor, and I just met her like a couple of months ago, well, virtually, but she has shown so much support and so much interest in the work that we do at One Health and Development Initiative. And she, over the last few months that we've been discussing and interacting, I was very, very happy to find out that she was also a supporter of even young people, students and young people that are growing in the One Health profession in their respective fields. So without saying too much, I want to welcome Dr. Cheryl Stroud. She is a veterinarian. She has a lot of experience in academic research and training, and she has also done a lot of private veterinary practice, and she's proudly a One Health practitioner too. And she has also done a lot of research in vector-borne and zoonotic diseases. She has taught, she's the executive director of the One Health Commission, and there she has been very, if you've gone to the One Health Commission website, you will see that it's one of the most resourceful and one of the most informative websites you will find on the web when it comes to getting resources, information, events, even connecting with people who are working in areas of One Health from all over the world. I would enjoin all of us to go to the website, go through each page, the resource page, and you'll find so much that you have to learn, so much that you have to know about the work that we do in One Health globally. And also it's an opportunity for you to also network with other people, because there are also information on organizations, on individuals, on research institutions, on NGOs, on so many people that are doing work around the world on One Health. So she has been very instrumental in establishing this for us to use globally. So she's also an educator of One Health. She does this even for, she has done for places like the CDC in the United States, for medical institutions, and even for people in the veterinary practice and across various fields. So definitely she's very, very good at what she does. And I will just give her the podium now.
Thank you.
Virtual podium to continue to proceed in teaching us about the topic we are on today.
Thank you, Kiki, for all those very kind words. I'm blushing. I'm not sure I deserve all that, but I am very passionate about One Health. I have been called the One Health missionary. So I would like to talk about One Health in the very big picture today. Are you hearing me okay?
I am.
Okay. So I always try to thank the organizations that do financially support the One Health Commission. There's no way that we could do what we do without them. So I always tip my hat to all those organizations. What I'd like to do real quickly is, I'm assuming most of your mentors and mentees are quite familiar with One Health. So I would just like to remind us of the many faces or the many arenas that are begging for One Health, give you a few updates from One Health around the world and some of the One Health Commission's activities. And you're probably, the entire group is expecting me to talk a lot about coronavirus. I think we're all being saturated with coronavirus information right now, and some of your mentors and mentees may be very, very actively involved in it. It goes without saying that what we are experiencing right now, this pandemic, is what the One Health community has been teaching and warning about for over 15 years. And it's you know, everybody on this call, I'm sure, knows that this started as a zoonotic disease. I'm shocked when I find so many people in the public who do not know what a zoonotic disease is. So when I'm speaking to people in the public, I always have to explain what a zoonotic disease is. And we're really trying to raise awareness among law and policymakers now about, telling them what we're seeing right now is exactly what the One Health community has been warning about. And hopefully it will bring us closer to a tipping point to actually fully implementing One Health. It's really amazing how our activities as humans pushing ourselves into more of the domains and terrains and lives, living spaces of wild animals that is one of the driving forces for some of the zoonotic diseases. So I'll just start out by telling you it was zoonotic diseases that started the One Health conversation, probably coming out of the ecology sector back in the late 90s when they started saying, look, there are these diseases that people are getting from animals, and they started talking about it, and the veterinarians around the world picked it up and started saying, oh my gosh, they're right, and the veterinary sector started talking about it a lot, and almost to the detriment of One Health, because some of the other professions thought, oh, that's just the veterinarians tooting their horns, and they really weren't paying very close attention until things like avian influenza and HIV/AIDS, which a lot of people don't realize started out as a zoonotic disease, and then SARS and Nipah and Ebola, and now coronavirus. So it definitely was zoonotic diseases that started this conversation. But what I'd like to share with you guys today, and what I hope to convince you, is that this One Health way of thinking really is our ray of hope for the future. And I want to just helpfully give you some arrows for your quiver as you're trying to help the world understand. If you want to play Cupid with the world and One Health so that you can help the world understand this. One of the main messages I share with people is that the collaborations that we need as we talk about this today are not just magically gonna happen on their own. In our current systems, we are so forced into silos. So for us to actually form the collaborations, the working relationships across the different sectors, we have to create those opportunities and come together, kind of like we're doing today. So that's my take-home message. The other thing is that I kind of think of One Health sometimes as a diamond. If you have a rough diamond, it hasn't been cut, and you cut it into a beautiful stone, it has a lot of different faces, right, or facets. And if you look into any one of those facets, you'll get a different reflective pattern. And I kind of think One Health is that way. There's so many ways that are arenas that are begging for us to do this collaborative work, and you get a different kind of view from whichever facet you're looking at, but it's all the big picture of One Health. So rather than dwelling on coronavirus today, I would like to help really step back and see a very high level view of all the many arenas that we really need to be working together in. We as human beings have a tendency to think that we're the most important species on the earth, and the planet Earth is the center of the universe. We really forget that we're part of an ecological continuum, that we really should be stewards of the earth and protecting all creatures on earth, and really understanding the value and the importance of the biodiversity. It's not just the kumbaya, oh yeah, it's really nice to have whales and tigers and dolphins and giraffes. It's really that they're incredibly important to maintain the balance of our ecosystems. And we as humans have a tendency to get those ecosystems out of balance. And that's one of the things that has driven us into a situation that, like we're living right now with the coronavirus pandemic. We really need to remember an underlying theme that the planet Earth, Mother Earth, is actually a living organism also, and that we really need to remember our place on the earth and remember to protect its health, because it will protect us that way. I love to teach One Health with stories, so I'm going to share one or two stories here. I'm not sure, I may have taken some out because I thought I had too many slides. So this is a story about a young woman. It's a true story. Her father's a veterinarian. Some of you might know Robert Miller. He writes a column, kind of a news column called Mind Over Miller in the DVM 360 veterinary professional magazine. So this is a story about his daughter, who was a journalist, and she traveled to South America on a fabulous trip. She, climbed a volcano and went way up the Amazon and did this wonderful story. And 2 weeks after she returned back to the United States, she was really sick. She had swollen, painful joints and fever and skin lesions and weird discolored fingernails and shortness of breath. And when she went to the doctor on radiographs, they found lung lesions. And also in her abdomen, they saw visceral granulomatous visceral lesions, which were probably the most concerning thing. And long story short, none of them could really put together. I mean, they knew she had traveled, but no, they couldn't really figure from what they were seeing how that could be related to her travel. So 2 years later, 76 specialists, 10 CT scans, enormous amount of money, they still didn't have a good diagnosis. They thought it might have been Hodgkin's lymphoma or non-Hodgkin's lymphoma or scabies. But the thing they were most concerned about were those masses in her intestines. They thought they might be gastrointestinal stromal tumors, which is a cancer process. So she was scheduled for an exploratory surgery. So they wanted to go in and find out what these masses were. But about that time that they were scheduling her for the surgery, her dad went to a professional veterinary meeting and was talking to some of his veterinary colleagues and telling them what was going on with his daughter because he was really concerned. And one of the colleagues says, oh, she's probably got a vector-borne disease. She needs to take some doxycycline. And another one says, oh, she probably has a parasitic disease. She needs to take some ivermectin. But one of them, somewhere along the way, connected Dr. Robert Miller, her father, with Dr. Ed Brightsword, who runs a vector-borne disease and intracellular pathogens lab at NC State University, North Carolina State University. And they convinced her doctors to send some samples to his lab, just to kind of make her dad happy, I think. So at this point, I usually pause and ask people if they can make some guesses. We won't take time to do that today. So what they found was Bartonella vinsonii. I don't know if any of you are very familiar with the whole species, the whole bacteria family of Bartonella, but I'd like to share with you a little bit of insights because this is a very emerging arena. This information has been in a big way coming out of the veterinary sector, and we've been having a terrible time getting the information into the human health sector. So back to her story, they did take her to surgery because it was scheduled, and her dad was getting the news from Dr. Ed Brightsword about the time of the surgery. So they go into surgery, and the surgeon comes out afterwards and tells her dad, well, we didn't see any evidence of cancer. And her dad said to the surgeon, well, I never thought she had cancer. I think she has Bartonellosis. And the surgeon said, well, I'm a surgeon. I don't know what that is. And so to me, that's, really points to our incredible need to find ways to communicate and exchange information. And I'll just, point out, so, what if her radiologist reading her CT scans and her x-rays, like 2 years earlier, had known about this bacteria, which can actually cause granulomatous lesions, and had seen those lesions and put Bartonella on the rule-out list and had helped get to a diagnosis sooner. So this is just an example. Not that the doctors are bad or the radiologists are bad. We're all products of our educational systems, and what we're being taught, it takes a number of years for new information to get into what we're being taught. And so a lot of us come out of school, and if we haven't heard about it in school, it must not exist, or it's not going to pop into our mind. So this ability to exchange new and emerging information across the different sectors is incredibly important. So I'd like to tell you a little bit more about Bartonella. Some of you may know it as cat scratch fever. There are a number of Bartonellas. In fact, every mammal that's been tested has its own version of Bartonella. There's a Bartonella henselae, which is probably the most common, is the one that's passed and vectored by cat fleas, not the cat necessarily itself, but the fleas. And there's also evidence that possibly it could be shed in the saliva of cats. But so there's a lot of emerging information coming out on this. And I'd like to tell you a really kind of amazing story of a success of a partnership between a medical doctor and the veterinarian, Dr. Ed Brightsword. So Dr. Robert Mozziani has a rheumatology practice with people in the Washington, D.C. area, and he deals with a lot of patients with chronic inflammation. And he discovered he ran across Dr. Brightsworth's work and called him up, and they started talking and formed this incredible partnership. They decided that Dr. Brightsworth had a study going where he knew that veterinarians were at really high risk for being exposed to Bartonella from all the animals and the insects, the vectors that they were exposed to in practice. And so he had a study going where he was, studying, looking for Bartonella in veterinary patients. So they decided that Dr. Mozziani would also send some samples from his patients, some blood samples from his patients, and just to see if any of them had Bartonella. Well, a year and a half or 2 years went by, and they finally said, oh, well, we better stop and see what we've got. And it turned out that Dr. Mozziani had sent in 200 blood from 296 patients. And I hope you're holding onto your teeth or sitting down, because of all those patients, 62% had antibodies to a Bartonella species, and 41% of them actually had Bartonella bacteremia. In other words, by PCR, they could, and a special culture media and PCR, they could actually find the DNA of active Bartonella in these patients. Now, that's a really high percentage. So some of the things that people who had been referred to Dr. Mozziani had been diagnosed with was Lyme disease, and some of them had been treated for Lyme disease and had not gotten better. A lot of them thought they had rheumatoid arthritis, and some had been diagnosed with chronic fatigue and fibromyalgia. And it turns out it totally changed the way Dr. Mozziani treats his patients. He looks for Bartonella and he addresses that. And many of his patients didn't have rheumatoid arthritis at all. They had Bartonella. So that has been a very powerful partnership. And I'm telling you that story because I think those partnerships need to be forming up a lot, everywhere. We as veterinary practitioners and human health practitioners definitely need to be seeking out relationships that we can share information and partner on different situations. I'll also just mention that it can manifest in so many ways. It can show up as neuropsychiatric syndromes with psychoses and depression. Neurological manifestations can definitely be part of the picture. It can pass in blood donors, in the blood and blood donors. It's very definitely a high occupational risk for veterinarians and animal workers. Very definitely an occupational hazard. And often when those animal health workers go to their medical doctors, those medical doctors often forget to ask, well, what is your exposure with animals and with insects? And they're not familiar with this particular disease process, Bartonellosis, and so they don't ask the right questions because they don't know to ask the right questions. So I'm bringing it forward to you guys to be aware and help spread the word. One of the most amazing stories to me is this, you see the image here in color. That is actually Bartonella that they found in the femoral head bone matrix of a veterinarian that had to have a hip replacement because of the veterinarian had Bartonella. So it was pretty amazing that it could get that deeply embedded in tissues to be actually embedded in the bone matrix. So I'm just kind of trying to make you aware of this. It also can, very common site for it to like to live is in the tissues of the heart. It likes to embed in all sorts of tissues. So it can be definitely a part of any cardiologic issues. There are groups that are forming up to educate about Bartonella. This image on the left here, this young lady's, she's a school teacher. She teaches K-12 or primary secondary students in Louisiana. And her son got Bartonella. This is her son, Jack, right here. He got Bartonella when he was about 11 years old. And he went from being a young, active young man and an athlete in a wheelchair to in a hospital bed. And it was Dr. Mozziani, the MD I told you about, who was able to finally diagnose what was going on with him and help, literally, she feels like, save his life. So that's one of my teaching stories. There's so many vector-borne diseases that are just right in the middle of the One Health story. And we're thinking about climate change and environments changing, and mosquitoes and ticks, their range is expanding. In fact, Some of you may be aware that NASA and the U.S., the National Aeronautics and Space Organization, actually has a group that does remote viewing by satellite view of the Earth, and they can see where things are changing, environments are changing, deforestation is happening or flooding, and they can actually help public health officials anticipate what kinds of vectors may move into those areas and what they should be watching for on the public health front for vector-borne diseases. So vector-borne diseases are definitely a really incredibly important part of the One Health conversation, and making those partnerships to help us address them is a very powerful thing that we can do. Animals as sentinels for things that humans are being exposed to is another arena that we really need to be focusing on as One Health practitioners and helping the world understand. This particular image here in the United States, there was an area in Flint, Michigan, where some mismanagement for water source for people had a lot of people ended up being exposed to heavy metals and lead. And once they realized this and started trying to figure out how to mitigate it and how serious it was, because lead can, especially in children, lead can very definitely impact their mental and neurological development. So they're taking blood samples here from a dog to look at what the dog had been exposed to get an idea of what the people had been exposed to. And I can tell you story after story of how animals are actually serving as sentinels, and how we across the sectors need to be aware of that. And when there's some issue that presents, is to look around to the environment and the animals to help us figure out how we need to address those issues. I can tell you another real quick story on the animals as sentinels story in the United States, and I'm guessing in other parts of the world too. In the 1980s, polybrominated diphenyl ethers, PBDEs, were being impregnated into sofa upholstery and curtains and carpets and hard plastics like computer surfaces. I came out of vet school in 1981. I wasn't taught anything about hyperthyroid cats, but in the 80s, late 80s, we started diagnosing a lot of hyperthyroid cats, usually older cats. And this cat is just exactly what they look like. They, an overactive thyroid means they eat like a horse and lose weight, and they usually end up with some kidney issues and often end up with cardiomyopathies because their heart rates are running so high, they're really overworking their hearts. And so it turns out when we made that correlation, we realized that cats had been a sentinel for this exposure. These PBDEs could outgas into the dust. And of course, cats sit around on like warm computer surfaces and warm television surfaces back in the day when we had these great big televisions, and cats would love to sit on it. And then they would get covered with the dust that had this PBDEs in it. And of course, they lick and groom themselves, and they were getting quite a bit of exposure. Well, there's actually been research. Dr. Heather Stapleton at North Carolina at Duke University has actually looked for these PBDEs in the blood of small children and infants and toddlers. And she actually found very high levels of it. It's even been postulated that it could be contributing to the obesity epidemic that especially in the US we're seeing in young people. So these are powerful endocrine disruptors, these polybrominated diphenyl ethers. The cats were one of the first to let us know that they were disrupting our hormonal balances. For the cats, it was thyroid. For other species, it could be also. So that was a very powerful moment for us to realize that the cats were in the environment with us. We're living in shared environments with animals, whether they're companion animals in our homes or whether they're animals that we live with and larger animals that we live very closely with. There's another substance that some of you may be aware of in following the perfluoroalkyl substances. There's so many different forms of this. They're also incredible endocrine disruptors. And those are being used in non-stick surfaces for cookware. And the CDC not long ago did an incredibly disturbing webinar because they've actually looked and they have found it almost everywhere in water supplies, and just everywhere they look, they're finding these perfluoroalkyl substances, are also referred to as PFAS. So there's so much out there that we may be being exposed to, And cats also were checked, and they were also serving as sentinels for that. So there's so many things that we need to be paying attention to together across our sectors that could really help us all. I urge you, and you'll have access to these slides and these links, but I urge you to go and look at this story. This is a West Nile story, and this is Dr. Tracy McNamara, who has really become quite famous as a veterinarian at the Bronx Zoo in 1999. When West Nile came to the United States, about that time, they were having people die, mostly elderly people die. They were getting quite ill with flu-like symptoms, and crows were falling out of the sky dead. So she at the zoo realized that the human practitioners were thinking that it was St. Louis encephalitis. It was one of the encephalitis that we often see in horses. But she knew that one species of birds at the zoo, the flamingos, should have been really sensitive to that and should have been dying, but they weren't dying. So she realized that it probably wasn't what all the health professionals thought it was, and she started looking for ways to prove it. So she ended up having to send some dead crows and some of her other dead birds from the zoo to an Army diagnostic lab in the US, and they identified West Nile. It was the first time it had ever been identified in the Western Hemisphere, and I'm sure in your part of the world it's probably been around for a while. But it was a wake-up call for the United States because the diagnosis was missed, and as a veterinarian, she struggled to get the word out that, hey, this is not what we think it is, this is something brand new. So it just takes a lot of awareness on the part of all health professionals, whether you're working with two-legged or four-legged creatures, and whether you're working in public health or in clinical practice. We really all have to kind of approach our work with a wide-eyed curiosity of what if this was something new, or what if this was something we needed to be working together on, and make sure that all the sectors are at the table when we're planning research projects or educational programs. Make sure that we're framing those in a One Health fashion. Antimicrobial resistance is another really hot topic right now. It's kind of been put on the back burner with COVID-19 right now, but it is a quintessential One Health issue, and it's still a problem all around the world. I know many countries are outlawing the use of low levels of antibiotics for growth promotion and animal protein production for poultry and swine and beef. We've outlawed it for growth promotion in the United States, and I know Denmark was one of the first countries to really try to do that in a big way. But I'd like to make you aware of this little book, One Health and the Politics of Antimicrobial Resistance, that my colleague Laura Kahn has written. She actually spent 5 years researching that book, and a number of takeaway messages came out of her effort there. She realized that the antimicrobial resistant organisms and their genes, if you will, have now been unleashed into the environment. And so we're seeing antimicrobial resistant organisms in marine mammals in the ocean who've never been given antibiotics. Some of you may be familiar with the report that came out in 2016 and published in the Transactions of the Royal Society of Tropical Medicine and Hygiene, estimating that if we leave our antimicrobial resistance situation unchecked, that there could be up to 10 million deaths a year by 2050 to people dying because they're infected with bacteria that are resistant to the antibiotics that we have. So this is kind of the way we as humans have not really realized the impact of how we use these drugs and how we let them get into our environment and how that can impact our environment and therefore our health. So this is the complete circle of One Health, from the environment to the humans to the animals, and the interconnectedness of the three. So this makes One Health very, very real. Right now, this shocked me when I realized that up to 700,000 deaths are already occurring every year from people being infected with bacteria and microorganisms that are resistant to our antimicrobial drugs. So we have let this into our environment. We know that these antimicrobial resistant organisms are also in our soils. We've got to have to keep an eye on soil health. It's incredibly important. The microbiome of the plant root ball, the rhizosphere, if you will, is incredibly important for how nutrients are absorbed. We also know that these organisms can actually get into the plants and that they can actually make it to people that way by eating the plants that are containing these organisms that are have antimicrobial resistance. And the exchange of their gene pools in the environment is one of the really frightening things. We now know that the microbiome in our guts and our intestines are as important, in the soil is as important as the microbiome in our guts. And we know that that microbiome in our guts is incredibly important for even immune function and our overall health. So I guess one of the points I'm trying to make here is just how interconnected all these systems are, from soil and plant health to what we're doing to to allow antimicrobial resistant organisms and gene pools into our environment, to how we as humans have accelerated that process. Yes, bacteria are normally evolving all the time anyway. This is a natural process, but our actions as humans, not realizing what we were doing, has accelerated that process. So it's once again the situation where we as humans need to reframe our attitudes about our place in the ecological continuum on the planet. It's just another teaching example. Another arena that we need to be absolutely working to join hands on, and we're really seeing this right now with this pandemic, just how interconnected and interrelated all of our systems are. I know in the US, they're having to shut down processing plants for beef and poultry and pigs because people are sick in the processing plants and they don't have enough people to run them. And that is going to affect the availability of protein, even in a wealthy country like the United States. So I know that all around the world, we're concerned about that. What's really concerning to me is that I don't think we have quite taken it seriously enough about providing protective equipment to the workers in those plants, giving them all masks and all taking precautions so that they're not infecting each other when they're standing side by side on a processing plant line. And even here in the US, we're starting to see farmers are having to plow crops under because they don't have the farm laborers to go into the fields to harvest the crops. So the entire food chain is in jeopardy. And I'm sure it's that way all around the world. So food safety and food security, you're all aware, I'm sure, of E. coli 0157 and salmonellosis and Campylobacter, a lot of the zoonotic pathogens that can pass in food. So the entire arena of food and water safety and security is begging for us to make sure that we are addressing and working together with all of the sectors at the table, and that often doesn't happen. Most often the animal sector and the animal health providers who have a lot of insight and background are very often left out of the public health picture. So we really have to work on that, as those of us who understand that One Health really is our ray of hope and that we have to be doing this. On the food security front, one of the frightening things is that around the globe we're losing a lot of our pollinators. Bees and butterflies and even bats are struggling. For bees and butterflies, it's often climate change and pesticides in the environment. For bats, white nose syndrome and things like that are declining their populations, and they're so incredibly important. You guys are probably aware that in some countries they're having to hand pollinate crops because there are not enough pollinators. Even in the United States, which has got a huge load of pesticides in the environment, that you can actually do rent-a-bee programs where if a farmer is trying to grow a crop, he can rent beehives to put them there by his crops so that those bees can pollinate his crops. So we really need to be paying attention to the environment and to the animals that we so totally depend on to help us with our food supply and to maintain that ecological balance, and realize that every creature, from the smallest amoeba to the largest mammal on the planet, has its place, its very important function to maintain the balance of ecosystems. And there's just been more and more calls now that we really need a wake-up call that our food systems, the way we're producing our food right now, well, one of these days we're going to get a wake-up call from nature. In fact, I think we got a wake-up call right now in this COVID-19 pandemic, because it was a food market that we first started realizing how serious this was. And so we can have a huge conversation even about the wet markets and consumption of wildlife, because there are many places where the wildlife is a huge part of their protein source. But one of the things that we have to realize is how we go about that. If you cram a lot of wildlife species together in a small space with people, like some of these wet markets, you're setting up a perfect One Health storm for the jump over, the spillover of pathogens from a wild animal that it's not hurting to a species that it can hurt, like us as humans. So our food systems we've got to really look at them closely. And I'm not saying that we should do knee-jerk responses. We have to be very very deliberate and planning how we're going to respond. Many people are calling for outlawing the wet markets, and I think that could be a very good thing. But what we have to be very cognizant of is those are, in some places, very deep cultural traditions to consume special wildlife. And if you ban something or you outlaw it, it often drives it underground. So it could actually increase the poaching and the illegal wildlife trade. So we really need to come at this with eyes wide open and figure out the very best way for the larger long-term public health to address these really serious public health threats. So I love this map because it kind of shows where we are around the world, and it really kind of, for me anyway, brings home the question of how are we going to feed over 7 billion people, which we anticipate to have probably in the early 2040s. How are we going to feed all of us without destroying the world and destroying our environment? So we've really got to start working together to figure that out. Another issue that we're really not addressing as a global society is population expansion. I think education is going to be our answer to helping us as humans understand through education, and responsible family planning and responsible food production, how we're going to do this, because it's going to be a really big challenge. And those of us on the call today are not going to live to see how bad it's going to get, but you young people are going to be the ones that help figure it out and really implement this One Health ray of hope. So it puts a whole new slant on the whole topic of food and water safety and security. Are we going to be fighting wars over water? We already see situations where there's starting to be a lot of controversy. So we've really got to balance the equation of number of people and ability to produce food, and we've got to do that in a very socio-cultural, non-threatening way. So there's a lot of big questions that we're going to have to answer together. And animals, the human-animal bond is a whole nother area of really importance in the One Health conversation. Some of you are really very aware of this, I'm sure, the impact that animals can have. I urge, when you get the slides, go find this YouTube about Petey and Eric, because it's a beautiful story about how this gentleman was really obese and out of shape, and the doctors told him he better go find a burial plot because that's where he was headed. And so he took his life in hand and he got a dog, and he says the dog saved his life because it gave him something to live for and got him out of the house and got him walking and eating better and literally saved his life. So the human-animal bond is incredibly powerful and important. And also there's a dark side to that, because some of you may be aware of an organization known as the National Link Coalition. It's an organization that tries to bring attention to the link between domestic violence and violence against humans and animal abuse. So often the people who end up in being abusers for people or even murderers have a history of being exposed to or actually doing animal abuse. So there's a big movement now to help law enforcement officers and health providers realize they need to ask people if they feel safe in their environment or if their animals are safe, because often perpetrators of domestic violence will threaten to kill or harm people's animals and they won't leave. In fact, I could tell a story about a woman who was being attacked by her abuser in her home, and when the police showed up, she wouldn't leave because the abuser had threatened to kill her Great Dane, who had really literally put his body between her and the abuser when the abuser came at her with a hammer, and the dog was taking the blows to protect the woman. So, these are some really important, this human-animal bond is extremely powerful, and not just for companion animals, but also for large animals. So at least here in the US, we're trying to do things about this. Animal cruelty is now a federal felony. So, and there are actually programs to try to pay attention to the smallest and most overlooked and neglected victims of domestic violence, and that would be the pets. And there are also shelters that are, because of the National Link Coalition's work, they've been trying to set up situations where victims of domestic violence would actually leave and take their pets and have a place for their pets to go also, because they often won't leave because there's nowhere for their pets to go or the shelters won't take them. So these are very complicated social issues, and One Health is incredibly important for it. In fact, we have a One Health social sciences group that is trying to help us realize that the sciences, the medical sciences don't have all the answers. Many of these situations are going to require the social scientists, the psychologists, the behaviorists to help us figure them out. So I have a lot more slides. I want to just go quickly here through. I hope that you guys are aware that kind of parallel to the One Health movement, there is a One Welfare conversation going on that's trying to help us really pay attention to the welfare of animals as well as people, and include that in the One Health discussion. So I urge you to go and check that out. Comparative medicine and translational research. There are so many disease processes that we share as humans and animals, and so many cancers that we get that are exactly the same. Glioblastoma brain tumors are exactly the same in dogs as they are in people. And if we can find those naturally occurring tumors in animals and the dogs and study them, we can get information for both the people and the animals. There's also actually, I'm not sure if this is going on around the world, but in this country, it's very exciting to watch dogs being trained to sniff out cancers. Now, that doesn't mean they're sniffing the people, but they're sniffing samples. And at University of Pennsylvania, there's a really active program that's training dogs to sniff out ovarian cancer. So that's not that dogs would go be sniffing women, but they would be sniffing samples. And what we are hoping, the technology, once we could figure out the aromatic compounds that dogs are sensing with their incredible sense of smell, is that we could get like a technological digital fingerprint of that and then find a way to technologically detect it, because ovarian cancer is a very silent killer. It's very hard to diagnose or detect it. So, these are some exciting things on the forefront of working in between the animal and the human health sectors. And I also want to make sure you guys are aware of Zubiquity. Zubiquity is a book that was written by Barbara Nettison Horwitz and Catherine Bowers. Barbara is an MD, a cardiologist, and UCLA Medical School. And she was invited to consult on a primate at a zoo. I think it was in San Diego. And she went there and she was so impressed by what she saw the veterinarians doing, and she got to talking to them, and she said, oh my gosh, what? Cats and dogs get diabetes and all these other situations, that she realized that her colleagues in the human medical world did not realize that there were so many things that the veterinary world sees that they also see in the human health world. And so she wrote this book. She and Catherine wrote this book, Zubiquity. And now for the past 6 or 7 years, they've actually been leading Zubiquity conferences, usually at a location where there's a zoo and a hospital. And the conference attendees will spend some time in both places and kind of reviewing and discussing a lot of the things that are seen in both the animal health world and the human health world to see just how we can learn from each other. That's the whole point, is we need to open those avenues and pathways and mechanisms for us to collaborate and exchange and share information, because in our current systems, we've been pushed into these silos and we're unable to do that. Non-communicable diseases are a whole nother area. I'm just showing you many of these cut faces of the diamond that is One Health. Disaster preparedness and relief. In the United States, we got an incredible wake-up call in 2005 with Hurricane Katrina that devastated New Orleans, because rescuers were, running around in boats trying to pluck people off their rooftops, and many of these people would not leave because the rescuers were not prepared and would not take their pets. They had their pets on their rooftops with them. And it's been estimated that at least 300 people died because they wouldn't leave when the rescuers came to get them, because the rescuers wouldn't take their pets with them. So we learned this incredible lesson: don't show up without pet carriers, and don't go into a disaster response not knowing how you're going to manage the animals. And in many situations, especially on the continent of Africa, where people are so dependent on their animals, if you have a disaster, and this was especially true in Haiti, if you have a disaster and you go in only to rescue the people and not the animals, what would those people have to go back to if their animals have not been saved and have been destroyed by the disaster? So in many cases, caring for the animals is caring for the people, and a lot of the world doesn't realize that. I hope all of you are familiar with the United Nations Sustainable Development Goals. Many of us feel very strongly that One Health is a way to fully implement and achieve those goals. We feel a great concern that the world doesn't realize that, and they're not really taking it as seriously as possible in many countries to really achieve these goals. They're very lofty goals, but very, very needed. So many of us believe One Health could be a way to do that. And some very famous people have been pointing out exactly what we're seeing right now. Bill Gates started saying in 2015, because he had helped out with SARS and Ebola, that we were just not ready. So when you get a chance to go and look at some of these slides, and please take a chance to listen to some of these. The economic benefits of actually using a One Health approach are enormous. There are just multiple publications about how coming at something with a One Health approach can make us so much more efficient and allow us to save a lot of money by doing things in a One Health way and getting all the needed sectors at the table. So I urge you, I'll show you in a second where you can go on the website, but there's so many publications that are making this case, especially coming out of USAID and some really pretty powerful organizations. So what can we do? I think all of us really get this, but we are struggling to figure out what we can do. So Kiki is doing her part. She's got this One Health Mentor program going, and the whole idea is that you guys will become much more familiar with the bigger picture of One Health and all the many ways that in your profession, how you can behave that way. Our challenges are just, we have so many challenges. Our academic processes don't really understand and necessarily reward work across the professions. You have to really focus on your own little area when you're publishing so that you can get lots of brownie points when it comes time for tenure. Our government agencies are in silos. This is very true in the United States, and other countries where people I've been working with report the same thing. Our industry research is proprietary. We don't want to share information. Our publication systems, this is the one that really gets me, our publication systems, even though most research in most countries is funded by public tax dollars, and the research then gets published in journals that are owned and operated by professional organizations, and only members of those professional organizations have ready access. So open access publishing is helping. It's got its own challenges for keeping the quality and a very strong peer review process in place. But it's just an example of one of the systems that have pushed us into our silos. And even simple things like the language barrier, using different acronyms used from different professions. It can be very intimidating, especially for older practitioners, to go and talk to somebody in another profession, because, oh my gosh, they might use an abbreviation that I don't understand, and I would look stupid to have to ask what that abbreviation was. So we've been forced into our silos by our systems. We're going to actually have to join hands ourselves and deliberately find ways to get ourselves out of those systems. This One Health conversation has been going on for a very long time. Starting even back in the 1880s, we had people like Rudolf Virchow who were realizing that we really needed to continue to pay attention to both human and animal health. And then as we became more specialized, we have moved more and more into our silos and less thinking in a holistic, big picture way. Don't get me wrong, we need our specialties. We've learned a lot from our specialties. We just need to remember as we go into a specialty to be able to keep in mind and to interact and be aware of and to learn from the big picture and from what's going on in other sectors. So these are incredibly difficult challenges. There have been a lot of organizations, I'm going to flip through these quickly, that have worked to try to advance this One Health conversation. Starting especially in the early 2000s, it started really getting some grassroots discussion. Organizations like the One Health Initiative group, which is really just a group of individuals who have done an incredible job of educating about One Health around the world. And our One Health Tripartite, the FAO, OIE, and WHO have all pledged several times to work together. I think it's a lot harder, more difficult to do. It's easier to say than to do, but they are trying, especially on things like antimicrobial resistance and avian influenza. And even now I can see things with this COVID-19 issue that we're really having to scramble to get our brains around just how to respond to. The One Health Commission that I work with started in 2009. 2009 was kind of a busy year for One Health. CDC stood up a One Health office, which has been doing a great job, and USAID launched the Emerging Pandemic Threats Program that you guys are probably familiar with, that OSHA, which is now called AFRIHUN, and SEAHUN are really direct outputs of that. You can actually see it on the map because it was all done in a very One Health way. If you haven't visited the CDC One Health webpage, please do. There's a lot of information there that's freely available to the world. We've seen more and more, as you guys are aware, more and more congresses around the world starting in the late 2000s, early, like 2011 or so. The Global Health Security Agenda, I hope you guys are aware of it. It looks like Nigeria is part of that system. It's an organization, it's a structure, a mechanism for countries around the world to evaluate their readiness for a disaster. I regret to say that we're not far enough along that it had us ready for what we're experiencing right now. Unfortunately, the United States has really bungled this worse than a lot of countries, so it's kind of frightening to realize that one of the wealthiest nations in the world has not managed this very well. But the intent of the Global Health Security Agenda is to help countries around the world be prepared for something like this. There are groups like the Network for Evaluation of One Health, which they now call themselves the Network for EcoHealth and One Health, that have also done incredibly good work to try to help us understand the importance and actually evaluate arenas that are important for us to do One Health implementation in. Some of you may be very familiar with the One Health platform that runs the International One Health Congress and a One Health Journal. The Congress was scheduled for June in Scotland. It's been delayed now till October, still going to be in Scotland. So I work very closely with the One Health platform. We worked together to launch One Health Day, which started in 2016. I hope you're all aware of it. I hope you're aware that there was a student competition that you could participate in and actually win cash awards. So this has been very exciting to see the events every year all over the world. It kind of shows you on the map where One Health is being implemented. So I know I'm running out of time. I'm probably not going to get time for questions. There are a number of other things that I was going to share with you, but you will have this. I'll make this slide set available to you. I know the recording will be available. The Planetary Health Alliance has been trying to work at the human environment sector to point out what we as humans have been doing to our environment and how it turns back and affects our health. They don't do the full One Health spectrum because they would never get into human-animal bond and comparative medicine, but what they're doing is incredibly, incredibly important to raise awareness about the human health and environmental health intersection. There's so many resources out there now that you guys can find on the Commission's website. I hope that maybe this, well, all of them are incredible. I forgot to put one on here. There's actually a textbook, Introduction to One Health, that I think is a great primer for One Health. So I hope you'll go on the One Health Commission's One Health Library page. It's under Resources and Services, and go down through books and find some of these books and actually read them. So I told you that I would show you, we actually have on the Commission's website, we have queued up a whole list of publications on the economic benefits of One Health. Some of you may find those useful, and also on the core competencies of One Health. It's incredibly important as we as One Health practitioners try to help the world understand, and as we try to incorporate One Health into educational systems. I haven't had a chance to tell you about our One Health Social Sciences group. I hope you'll go check it out. Be sure, if you would like, that you get on the One Health Commission's listserv to get One Health happenings. This is the newsletter that we put out monthly. There's an opportunities bulletin board. It's set up in such a way that if you know of a One Health opportunity, you can submit it directly yourself, and you can also see opportunities there. So I really, really urge you to go check out all these resources. I think they can be very helpful. One of our most recent and exciting initiatives is we've launched a One Health for One Planet Education, or One Hope initiative, trying to find ways to get One Health incorporated into primary and secondary education, as well as some of what we're seeing happening already at colleges and universities. But we're also giving opportunities for people from around the world to come together to initiate programs to do One Health education in their communities for civil society. And there's also a group that is working to try to work at the government level to help lawmakers and policymakers understand One Health and the importance of, the responsibilities that they have in making decisions. So I know some of you are having to leave. I'm going to flip very quickly through. There's so many more resources I was going to share. The students, by the way, there's an incredible International Student One Health Alliance. They have a mentor program, just kind of in parallel to what you guys are doing with Kiki and One Health and Development. These are the current leaders, the current International Student One Health Alliance Executive Committee. You'll notice that there's actually a young man from Nigeria who's Vice President of Finance. And if you happen to know Yusuf Mudu-Bule, please tell him that you heard that he was serving with the International ISOHA, and get involved and help raise funds for some of the One Health activities that the student groups are wanting to do. So it's been incredibly fun to work with those students. In the United States, we have 2 One Health bills in our Congress right now. I wish we had them in place before what we experienced right now, but we're working on it. It takes a while to help lawmakers understand. And please, I wanted you guys to be aware of this exhibit called Outbreak that the Smithsonian Institute created in Washington, D.C. If you can't get to Washington, D.C., please, 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 this exhibit travels. It's going all over the world. I think I've told Kiki about this. It's going all over the world. You can communicate with the people with the Smithsonian, and they will help you bring the exhibit to your area. You could bring it to a library, to a community library or a university library, or a conference, or a mall, or a shopping center, to help educate the public. This one is all about zoonotic diseases, starting with influenza. I lost my own great-great-grandfather in 1918 flu pandemic. So it starts with that pandemic and leads you through SARS and MERS and Ebola and Nipah, and they're probably scrambling now to put together part for that for coronavirus. And so this exhibit will actually be running until November of 2021. But my understanding is that the travel exhibit will continue. So I'd be very happy to work with any of you to connect you with the Smithsonian people to help you bring it to a location near you. So we have covered a lot of material. I hope that some of my take-home messages will really resonate and stick with you. It's the collaborations that we kind of need to go out of our way to reach to, the medical doctor or the pediatrician. If we're a veterinarian, to reach to those, to create, form a relationship so that we feel comfortable picking up the phone and calling each other when we have things that we think could possibly, be at the intersection I love to tell the story about the family that had the puppy that had Sarcoptes mange and went to the veterinarian, and then the veterinarian had to when diagnosed the Sarcoptes had to tell the people that this could affect you. This it could affect you could be having little itchy red dots, and so please tell your doctor to call me so I can help him understand that this could be Sarcoptes. So this One Health concept, this movement, is really not new. It's actually a very ancient wisdom that we're trying to resurrect. If you think of indigenous societies, how they value and protect and take care of their environment, and how they value the sanctity of all life, even when having to take life to survive, then it helps you really realize the whole really big picture that really underpins the whole One Health conversation. It truly is our ray of hope. We need to heal the past, live the present, and dream the future. I invite you guys, if we can't envision what the future could be like, if we fully implement One Health at all levels of academia and research and government, then it'll never happen. But if we can dream the future and kind of move us toward the way we think it ought to be, we can have a huge impact on the world. So kudos to you guys for being in this mentor program. And thank you so much for listening. And I apologize if I went over time. Kiki, I'm so sorry.
Thank you, Dr. Cheryl Stroud. We've learned so much, and I think we'll just go straight right to the questions. We can only accommodate 3 questions because of the time. So if you have any questions, please make sure, if you're going to speak, please make sure you're in a very quiet environment so that we can hear you clearly. But if not, please write your questions into the chat box. So are there any questions, comments, opinions, No questions?
I have a question.
Can everybody hear me, please?
Oh, yes,
I have a
question. I have a question. Can I go on, please?
Yes, please. Mm-hmm.
Yes. I'm interested in knowing if there are diseases transmitted from monkeys to human beings, especially if they live in a human environment.
Okay, you might need to repeat the question. I'm not sure what the question is.
I want to know about diseases that are transferred from donkeys to human beings if they live from monkeys to human beings.
Okay, monkeys. Well, so as you know,
they live in the human environment. Did you get that?
I think you want to know about diseases that can be transferred from monkeys,
yes,
which are primates like humans, to humans.
Yes.
And so because monkeys and humans are primates,
yes,
most of the diseases that humans can get, monkeys can get, and that monkeys can get, humans can get. So if we put ourselves in situations where we have close contact, we need to be paying attention. Ebola Reston is, one of the ones that I think of, Ebola in particular, and HIV/AIDS came from, we think, from primates in the jungles of Western Africa back possibly in the 1940s. So you could write a book about the diseases that can pass from monkeys to humans. And the environment and what we're doing to the environment, if we're encroaching on the monkeys' domain, and in so many cities around the world, monkeys are just right there in the city. And I've been hiking in Thailand and had them jump on my shoulders. So there are a lot of interactions that we have with these primates that we need to be careful of. I mean, one of the first ones that comes to mind is rabies. But there's so many of these diseases that can jump between us.
Because I know that in Nigeria, where they have encroached on their habitat, they go into the water tanks. I've seen a video where monkeys were actually swimming in a water tank, and I said, wow, and that water tank is used for domestic purposes. So I'm wondering.
You are so right. That is terrifying. Those water tanks need to be covered and not allow the monkeys in them.
Okay.
there are so many challenges that, you know, we just need to open our eyes and look around. Some of these things are really simple, really duh, like what? We have monkeys swimming in the water tank that people are drinking. So some of these require us going to public health officials and government officials and putting in place things that can remedy that and not allow that to happen. And you guys are in the perfect situation to do that. So did you have another comment? We need to mute that microphone for background reasons, but do you have another question?
Are there any other questions?
Yeah, can you hear me?
Yes, we can hear you. Okay, Dr.
Yeah,
Stephen.
it's Isaka Stephen talking. I just wanted to know if there's something we can learn from what you have done in the United States, because in Nigeria, the awareness is kind of there, but people are not really doing much about incorporating One Health. You know, the medics are dealing with humans, the vets are dealing with, the veterinary doctors are dealing with animals, and each is trying to protect his own territory. So they are not really talking to each other. And from the presentation, we can see is there are a number of animal diseases that can be acquired by humans. So I think we need a deliberate attempt in terms of making maybe laws or policies, and that will mandate the professionals to talk to each other about these diseases. Can you share your experience in that? Because I heard you mentioned you have a kind of bill presently in the Senate or something.
Yes, so I'd be happy to discuss that. As you know, or maybe you don't know, but I will make you aware that some countries are doing One Health a lot better than the United States. We are struggling in the United States to get our lawmakers to understand understand One Health and to really help our agencies. In the United States, our NIH is all about human health. Our USDA is all about animal health and preventing diseases that domestic animals could get to humans. Our FDA is all about food safety in general, and they don't work together. In fact, we have laws on the book that prevent them from actually sharing resources and sharing manpower. And I can tell you story after story of when we needed to be working together and wanted to be working together, and the systems and structures were not in place. So in the United States right now, we have introduced last June and July into our Congress, which is made up, as you guys probably know, a House and a Senate. We had introduced into both our Senate and our House a One Health Act of 2019, which would create a One Health platform to allow our agencies, actually to require our agencies to work together. And so that right now, those are not law yet. They are sitting in what we call referral committees, waiting to be brought to the floor for a vote. I wish we had had them enacted before COVID-19 hit. I think we would have been in a better place. The United States has bungled this in a big way, and part of it is our disjointed approach to public health and our inability to really know and be prepared for these kinds of situations. The Emerging Pandemic Threats Program that I know Nigeria was not privileged to be part of that early on. I understand that the next iteration of that, the One Health Workforce Next Generation, which is reframed ASHEA to be called AFRAHUN, and also the Southeast Asia One Health University Network, SHEAHUN. I understand that they're trying to expand that to include more countries in Africa. So you might want to check how you could get involved. It's all about education, 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 to really educate the public, to educate our young people, and to educate our lawmakers. So I cannot point to the United States as having done this very well. I wish I could. I can point to countries like Thailand and Vietnam. I know Uganda and Rwanda have both been trying to do this. I know that there in Nigeria, Tayo Bebelobi has been working for a long, long time, and Nigeria has a One Health strategic plan now. So this is a marathon for those of us who get this and understand this concept, to actually do what each and every one of us can, wherever we are, and how, you know, to reach out and to help our lawmakers. One of the challenges is we as scientists often are not very good at communicating what our scientific knowledge to the public. And we as scientists are not very good at really making lawmakers aware. So we've got to get comfortable going and talking to lawmakers and helping them understand what we're saying. Here in the US, this pandemic has gotten the attention of our lawmakers. They're going, oh, is this what you were talking about? So hopefully we will make some progress. Hopefully the whole world will make some progress. In fact, if you'll bear with me just one second, I want to show you something, because I really hope that you would go and look at this. So I'm going to pop over to the Commission's website, and I'm going to go to the news button. I'm going to drop down to Narratives of One Health in Action. And if you go to this webpage, you'll see that we have been queuing up since January popular media op-eds and commentaries about the coronavirus pandemic that are calling for One Health, or mentioning One Health, or mentioning how it's our destruction of the environment that puts us in this jeopardy. And I'm still scrolling. I started doing this in January. I hope you'll go and look at some of these papers, and I've got a whole much more to queue up to add to this. So I think the world is starting to get the message. Whether it will translate into real action when we get over this current pandemic, or whether we'll go back to business as usual, I cannot tell you. I know that I'm doing everything I can to make sure it is, and I hope that you guys are too. When you first started talking, I thought you were going to ask what we were doing in the United States for COVID-19, and the sad truth is not much. We're not making sure that people working in processing plants for food are wearing protective equipment to protect themselves from each other in case somebody's infected and doesn't know it. So I'm sorry my answer got long. I hope that helps what you were trying to learn.
Okay, thank you, Dr. Cheryl. So I have a question here that's shared by one of our fellows, Idris Allah. He's actually a medical doctor. So he said, I've really learned a lot from your lecture. Can you hear me?
Yes.
Okay, I really learned a lot from your lecture. In one of your slides, you talked about animal cruelty being a federal felony in the United States. I actually have first-hand experience of how Americans treat animals, even on the street. Please, how did you get to that level? Was there a massive advocacy drive, or people just felt it's normal to let the animals be? Here in Nigeria, a lot of animal cruelty is going on, and no one even bothers to talk about it.
Oh, no, it's heartbreaking, isn't it? And the sad thing is, when there's animal cruelty going on, there's probably human abuse going on too, because they're so closely connected. So all I can say is it's education, education, education. The National Link Coalition has resources that you can tap into. I'm the connector. I'm trying to help everybody be aware. So I'm constantly talking about all these issues. I can't say that it's perfect in the United States. I know that there are cruelty situations in the United States. There's cruelty to animals all over the world. In some places, it's a lot worse than others. So it's education, guys. We have to really kind of join hands, and like if you're working with like the National Link Coalition, you're trying to really help people understand that if you allow abuse to happen in animals, it's very, very likely going to also show up in the people. So that can make it very real to people. But how we did it here was just a lot of people who cared a lot about it and talked about it for a long time with lawmakers and policymakers, and just general grassroots education. That's really that's the magic key, is education. There's no magic bullet otherwise. We just have to do the footwork and the educational work to really help everybody understand the significance of this. And the poor animals, they don't deserve the cruelty that they're suffering. Right now, I've heard that in some countries, people were afraid that their animals could give them coronavirus, and they've actually been killing their animals because they were afraid that they could get coronavirus from it. There's absolutely no evidence that that can be the case, unless somebody has coronavirus and sneezes on your dog, and then you pet your dog. I guess that would be one way to do it, but that's not the dog's fault. So animal cruelty is, very near and dear to my heart. In fact, I may be standing up an action team to actually to look at addressing caring for animals in disasters. And if anybody on this call would be interested in working on an action team for One Health and and animal cruelty or animal abuse, or be part of, even partner up with the National Link Coalition, I would be delighted to support a working group to really put out educational messages around the world on those topics. Thank you for that question.
So I have one more question here from Andrew Oroke, who is also one of our mentees, our fellows. So thank you for such nice presentation. My question is there anything One Health Commission is doing to assist developing countries like Nigeria to implement the concept of One Health? Because there is currently a huge gap here in this part of the world.
Oh, yes, I love to, I don't have any programs where I can actually put boots on the ground in Nigeria, but everything we do is for education. And I know that Tayo Bebalobi has been in some of our discussions, and doing webinars with people like you guys are just so important to me. And I really find it very important to connect people who are doing One Health around the world so that they can find each other. And that includes every country, and on every continent is helping find ways to bring the message. So that's the way the One Health Commission is helping. You can see that we've got a couple of groups in Nigeria on the Who's Who map. I urge you that if you know of other groups in Nigeria that are working for One Health, to let me know so we can get them on the map. But what it boils down to, guys, is every One Health practitioner, no matter where they are in the world or no matter what their discipline is, has got to be looking around in their situation, in their job, and seeing what they can do to really help their government and their public health officials and their human health organizations to really understand the importance, the incredible critical importance. And this is such a great teaching moment right now with COVID-19, because you can say, look, this is what we're talking about. This is one of the arenas of One Health that we've been warning about and teaching about for over 15 years. Let's put things in place to prevent this. Let's evaluate whether we're going to have wet markets. If we're going to be consuming wildlife, let's make sure that we're doing it in a safe way and that doesn't endanger or make the wildlife extinct, because every creature has a very important role to play in our biodiversity. So as far as specifics, I don't have any specific programs. It's just that everything I do is for every country, including Nigeria. It's one of the reasons I'm so excited to be working with you guys.
Okay. So yeah, so in the absence of any more questions, I just want to say thank you so much, Dr. Cheryl, for facilitating this webinar, and thank you so much for everybody who has made him or herself available for this webinar. And I just want to mention 3 major things that I feel like we should take home from. I know we all have our take-home points that we've noted down or jotted down already, but 3 things that really came out to me was, number 1, the fact that education is very important, because if people don't know, then they probably will not even act. They probably will not take actions towards making something better or making a condition to be improved. So we need to get the word out. We need to continue to educate people. We need to engage people. We also need to implement the concept of One Health in our own respective jobs or jurisdictions, as a medical doctor, as a vet, as a plant scientist, as an environmentalist, as an aquaculturist, like in our different areas, which also brings me to collaboration, in the sense that if we have works we are doing, if we have our projects, we need to also think outside the box, outside of our own specialties, and seek to collaborate with other people. And I also, this was supposed to be a question, but when because it was supposed to be like a follow-up to what Dr. Stephen said, in the sense of how are things being implemented in the USA. And Dr. Cheryl answered and mentioned something about how they've been trying to get the lawmakers to pass bills, and how it would have been an important thing if the bill was passed at the time when COVID-19 came in. And I also think that the same thing with Nigeria, in the sense that there's really little we can do if the policies at the top levels, at the government levels, are not established, because those are the things that are going to make our work even more productive and our work even more fruitful. So even though we are doing our community level work, we are being productive in our respective jobs and all that, We also need to conduct some kind of high-level advocacy at the government levels with legislators in whatever capacities that we can to ensure that some kind of policy or a framework is set in place for people for One Health stakeholders, medical, veterinary, environmental, food, security, and the rest of it can collaborate, and that framework will be able to make our work, come out better. We'll be able to make sure that we are being productive at our respective work. So I think that's something. Those are things that I feel we should take home, including whatever you're also written down. So thank you so much once again, and I think we have come to the end of the webinar. Dr. Cheryl?
Yes, thank you very much, Kiki, for the work that you're doing, and I hope that all your mentors and mentees have a great experience working together in this program.
Yeah. So, okay, in the absence of nothing else, then we have come to the end of the webinar.
Thank you,
so
Kiki.
much.
Bye-bye, everybody.
Yeah. Bye-bye.
Thank you. Bye-bye.
Thank you.
Thank you so much for your time.
Thank you. Yeah, thank you.
Thank you.